Well, welcome back in. We are getting closer and closer to spring, but the welcoming of spring also means the dreaded arrival of sneezes, coughs, itchy throats, and more for your little ones. Dr. Meredith Lind, a pediatric ENT from Nationwide Children's Hospital, joins us with how we could spot some common ENT issues in kids. Thanks for being here today.
Thanks so much for having me.
Absolutely. I feel like when they're little, it's always, oh, they've got another ear infection. They've got another ear, and there's fluid in there. What types of things are you seeing right now?
Yeah, so end of winter, we're still sort of in the deep of cold and flu season, although hopefully, digging out of that soon. So lots of the viral infections that then the ear infections follow. And then, yeah, definitely starting to see some of the springtime allergies as well. So
how do you know the difference between the two? Because it's always like, do they need to get an antibiotic? Do they not need to get one?
Right. No, it's such a great question. And honestly, even for physicians and providers, it can be difficult to tell the difference sometimes. I think younger kids who are around other children, either in daycare or preschool, regular school, sudden onset symptoms, we're going to think more about viral type infections, which still, don't require an antibiotic most of the time, just supportive care. More long-term symptoms, seasonal symptoms, where you can sort of sense that pattern this time of year as things start to bloom and get warm.
Sure.
You notice more symptoms, watery, itchy eyes, sneezing, those types of things are more likely to be associated with the allergies as well. And then, when do you need an antibiotic? When do you need to be seen? I would say, high fevers, more severe symptoms that last longer than 10 days and still seem like they're infections. Those are times where might be worth seeing somebody to, see if something more serious is going on.
Especially when they're little and they can't really tell you what my ears hurt or this, whatever, this is happening inside my body, then that's when parents, it's a tough spot to be in sometime. But I think we also hear when they're little with the ear infections kind of repeatedly. At what point do you all need to sort of take things up a notch with treatment?
Yeah, it's a great question as well. Again, I would say first of all, even with ear infections, some of those will resolve on their own. So I think parents feel a lot of guilt if they feel like they've missed an infection in their child, but often that's because the body is taking care of it itself. But when kids are having frequent ear infections, or especially requiring treatment, I think it's worth, seeing a specialist to see if something else might be helpful for them. Usually the guideline we follow would be 3 ear infections in a 6-month time frame, 4 in a year, or fluid that doesn't clear after a couple of months from an infection. With that, we worry about hearing problems associated with that fluid.
You don't want it hanging out there forever. So your regular pediatrician would then generally refer you.
That's right. Yeah, we don't require a referral to be seen, but it's, I think, helpful for people to, have that contact, have that, recommendation from their primary care physician or provider as well.
Is tubes, is that still the big thing?
We do lots of ear tubes. Yes, that's it's the most common surgical procedure performed in the U.S. after circumcision. So certainly extremely common. And something that I think is still extraordinarily helpful for some young children, especially. So,
any new advancements with that? Or?
Yeah. So I think one of the things that we've started doing at Nationwide Children's, Toledo, and Columbus is what we call in-office ear tubes. So
that sounds like a game changer.
It's really nice for the right child. So for younger children, our age cutoff for that is usually 15 to 16 months for most kids who meet the criteria for ear tube placement. We can sometimes offer placing the tubes the same day in the office.
Wow.
So that's done with some local numbing medicine, no anesthesia. I had a little one this morning actually that I saw, and they met the criteria. They had another ear infection today, and so we were able to offer that for them. So, yeah, I think it's like I said, it's a nice option for the right family. It doesn't mean you have to choose that option. You can still choose to have the procedure done under anesthesia as well. And for older kids, I think that's still the way to go. It's just difficult for them to, kind of once they understand what's going on, it can be a little bit scary to try and do it.
A little bit, yeah. All right. Well, some interesting new information there. And then, parents, as we head into seasonal allergy season, just kind of check those symptoms and then, just do your best, right? That's right. There's some contact information on here on the screen if you think that your child might need to see a pediatric ENT. You can reach out, contact there. Doctor, thanks for being here today.
Thanks so much for having me.
Yeah, absolutely.
Appreciate it.